There's a serious warning tonight for patients at a clinic in the northwest suburbs.
It involves potentially incorrect mammograms. WGN's Gaynor Hall joins us from the newsroom with that story. Gaynor?
Taman and Micah, get a second opinion. That is the urgent warning from the state for patients who received mammograms at this troubled facility in Hoffman Estates.
All is quiet today at Hope Imaging, also known as Hoffman Imaging and Medical Center. But the Illinois Emergency Management Agency, which certifies mammography facilities, is sounding the alarm about the poor quality of images taken at the Hoffman Estates facility. In August 2020, the agency issued an emergency order for the facility to cease operations pending accreditation. The American College of Radiology conducted a mammography review of clinical images obtained from October 2019 through July 2020, revealing 16 out of 30 cases did not meet the imaging criteria, and the practice posed a, quote, serious risk to human health. But despite the order, state officials say the facility, under a new name and ownership, continued to perform mammograms, and about 100 patients were imaged between December 2020 and March of this year. A second emergency order was issued to Hoffman MRI Inc. to cease operations.
What we've witnessed is that people do come for their appointments and they knock on the door and there's no one there.
Diane Werner works at the travel agency next door.
It's a large amount of money to get CT scans, mammograms, x-rays, and if they had paid for that and relied upon that information and the information isn't trustworthy, that can be very, very sad and devastating.
And it's not the first time there's been trouble at the facility. In May, 41-year-old Omer Niatzi, who was previously listed as vice president of Hope Imaging, was charged with aggravated battery, forgery, and wire fraud after a female patient who went in for a CT scan in November raised concerns about his qualifications. Investigators say they learned he was not trained or certified to perform CT scans and submitted false credentials and unauthorized reimbursement claims to insurance companies.
So anyone who received a mammogram there in October 2019 or later should check with your primary care physician to see if you need to get a new mammogram. We have not been able to reach anyone from that facility for comment. Reporting live tonight in the newsroom, Gaynor Hall, WGN News.
Thank you, Gaynor.